Lisa, thanks much. Time for Ask Your Family Physician. Dr. Nathan Walker joins us from Christie Clinic. We have a couple of questions submitted by some viewers this morning. Carol wants to know what she can do about treating her osteoarthritis and rheumatoid arthritis in her hands.
Osteoarthritis is very common. It's the most common form of arthritis. Older people oftentimes get it as well. It's oftentimes in the hands. There's not a lot of things you can do to improve the symptoms except for actually just use the hands. So it might be a little bit counterintuitive, but frequently using the hands, and that's kind of what we do with hand therapy, actually helps the symptoms. And I also use some topical pain medications. Sometimes you don't want to use ibuprofen in high doses, for instance, by pill form because it can cause stomach ulcers and such. But those similar type of medications can be in a gel that you apply over your hands, and I've had pretty good luck with that. And rheumatoid arthritis is an inflammatory arthritis. It's autoimmune. Those people have very swollen joints oftentimes. So the treatment is usually what we call disease-modifying agents that they're almost like chemotherapy drugs that actually change the immune response in your body so that your body stops attacking itself. That's you need to see a doctor for that type of thing. The first line is to use NSAIDs. NSAIDs are ibuprofen, Aleve, that type of thing. And then beyond that, the medicines that really change rheumatoid arthritis are at your doctor's office. There's a lot of things they can use now.
All right, very good. Steve is asking, how long is the recovery time for a pulled groin muscle?
I saw that question, and I thought, this is a really interesting question, something I'm going through myself, and I'm finding out that it's a nagging injury. The problem with a groin pull is that you got to stop using it completely, and we use that muscle all the time.
Yeah.
And people refer to a couple of different things when they talk about the groin. One might be the hip flexor, which is the muscle that would help you to raise your hip this direction. One would be kind of towards the middle section, which would pull your leg in, and another, sometimes even the underside of the hamstring or the top of the quadricep muscle. So these muscles are all very, at the attachment, actually very superiorly or up at the very top of the muscle. It can be difficult to kind of get to it. It's difficult to physical therapy. Usually rest is the thing. And it's usually about 2 weeks of rest, and then depends on how bad the pull is, or if it's a bad pull, probably about 4 to 5 weeks.
Anything to do to treat it in the meantime? Ice, heat?
Right after you pull it, especially ice is really important. That can be very helpful. Sometimes people see bruising there, which means torn muscle and some blood there. Afterwards, heat, massage sometimes can help. They use something called A-stem at physical therapy offices, which help the muscles heal a little bit faster. So that might be another option for you.
All right, we had a couple questions rolling late asking about the flu. We've heard it upgraded to epidemic levels. You're saying that though maybe we might be moving past that big hump and kind of on the way down now.
Sure. So the statistics come out every week, and this week suggests that we've gone over the peak. And a similar peak happened last year at about the same time, right after Christmas. So the level this year is probably 25% higher than it was last year. It's a pretty big number. There's a lot of people with influenza. I myself have diagnosed a lot of people in our office. I know a lot of other primary care doctors have done the same. So I think it is very serious. The fact that the vaccine didn't quite work this year, we missed the mark a little bit, is one of the reasons why it's bigger than it usually would be, because there's a lot of people that have had the vaccine that still got the influenza bug, although they probably didn't get it as bad as they would have.
Sure. But real quick, running a little bit short on time, but it's going to get really, really cold, as we saw Lisa mention, over the next few days. Frostbite is going to be a concern. It won't take long being out in the elements. Obviously people need to cover up, but if they suspect that maybe they have frostbite, what are kind of the telltale signs, and how long being exposed in those elements before that could potentially set in?
Sure. I worry about people that are not able to say that they have cold extremities, so the very young and sometimes the very old. People that have neuropathy, like diabetics who can't feel their feet, they can get into trouble very quickly, and exposure is the big thing. Exposed skin will frostbite very quickly in temperatures like this, a few minutes even, sometimes maybe 5 or 10 minutes, something like that. So beyond that, they're cold extremities. There's oftentimes pain associated with it. A lot of people will make the mistake of putting their hand or something in hot water, and that causes more injury. Lukewarm water is probably what you want to do, and let it kind of reperfuse on its own. And if it's still painful after like maybe a few hours, for instance, I would go see a doctor.
All right, very good. Dr. Walker, we appreciate it.
Thank you.
Hey, we want to remind you that any of the advice in Ask Your Family Physician doesn't replace the advice of your own doctor, and if you have a health emergency, always call 911. We'll be right back.